Good morning. The time is 9:30 a.m. Today is May 23rd, 2024. I'd like to call to order this meeting of the Alameda County Lead Poisoning Prevention Programs Joint Powers Authority. This meeting is being conducted in person, and there is remote teleconference participation for the public using the Zoom link provided for in the agenda for today's meeting. This time I'll ask if Ladise would please take the roll.
Director Hardy. Alternate Arkin.
Here.
Director Vela. Director Wenruff.
Present.
Director Gallo.
Present.
Director Bowders.
Here.
Mr. Chair, you have a quorum.
Thank you, Ladise. Now is the time for public comment. A member of the public wishing to give comment for an item not on the agenda today, but in the subject matter jurisdiction of this agency will have 2 minutes to give comment. Are there any members present today wishing to give comment? Seeing none, do we have any written comments or comments online?
No comments.
Okay, public comment is now closed. We'll turn to item 3, which is the consent agenda. Consent agenda has one item, the meeting minutes of April 25th, 2024. Members, I'll call your attention to a correction that was made since publication to item 8 in the minutes, which was the minutes on the JPA meeting calendar schedule. There was a reference to rescheduling the December meeting from the 19th to the 10th. We actually just canceled the meeting. So there's no meeting to reschedule in that. And so the minutes, as reflected here, are correct. Is there any public comment on the minutes?
No public comments.
Comment being closed. Is there any further discussion or debate on the minutes? Otherwise, I'll make a motion to approve the minutes as amended in the red line attached to this packet.
Second.
Thank you. Motion by Bowders and second by Gallo. Wengraf, please call the roll.
Director Hardy. Director Miley, alternate Atkin.
Aye.
Arkin, aye. Director Vela. Director Wenruff. Wenruff, aye. Director Gallo.
Aye.
Gallo, aye. Director Bowders.
Aye.
Bowders, aye.
Ayes have it. The motion carries and the minutes have been approved. We'll move to item 4, which is the goals and objectives for fiscal year 24-25. Director Larry Brooks.
Thank you, Director, and good morning to all of the JPA directors. Before you take action on this item, I just wanted to make a few comments, beginning with thanking Ladise de la Fuente for being the person that is lead on putting this document together every year. She's the one who herds all the cats, including this one, in regards to bringing all the staff and managers together to provide input into the goals and objectives. And then just a few things that I will highlight that Ladise has identified for me as far as what she observed as some of the highlights of this document. And that are, we have been partnering with permit offices within the CSA cities to distribute paint supply kits to all CSA property owners. We have been collaborating with realtors to provide first-time home buyers in the CSA with informational packets on healthy homes principles. We have been conducting joint workshops with tenants, housing providers, and legal organizations on lead and healthy housing related projects. We have been providing outreach campaigns to increase blood lead screening rates. The provider outreach will be headed up by one of our public health nurses, public health nurse level 3, whose role is to focus on this during the current California Department of Public Health contract cycle. And then lastly, we have been given the privilege to implement a new HUD lead hazard control grant. HUD now requires radon testing in all units, and as you know, that is a gas that can cause all types of health hazards produced in many parts of the country. California, fortunately, in the Bay Area, it has not been as big a problem as in other parts of the country in terms of identifying radon gas coming up into homes and also coming up with ways to remediate it when found. But I applaud HUD in terms of providing this additional service within the contract. It will create some more work for us, of course, and the department is exploring different strategies for meeting this deliverable. So those are the comments we have, highlights of the goals and objectives document for you to take action on. Thank you.
Thank you very much. First, we'll take public comment. Is there any member of the public wishing to give comment on item 4, the director's, or the goals and objectives, I'm sorry, for fiscal year 24-25?
No public comment.
Comment is now closed. Please have the minutes reflect that Director Vella joined at 9:34 a.m. We will now turn to discussion. Are there any members who have questions or comments on the goals and objectives? I'll kick us off. I have a couple. My first is under the very first section that you've provided in the outline, the public outreach component, objective 1.1 on page 9 of the packet. You're proposing to reach an estimated 1 million Alameda County residents. That's about 60 to 65% of the county's residents. Seems like a very significant goal you're trying to achieve. Just curious how you reached that figure.
It is an estimate. We may not achieve it, but that is us setting the bar as high as we think we can possibly reach, utilizing the various resources and strategies that our education engagement team has come up with.
How will you be measuring this?
Social media, we will be able to do some monitoring of the outreach efforts in that regards. Then also in regards to different activities that we do within the community, we will be taking account of who attends.
Okay. My other question is on page 12, under the Healthy Homes Assessments and Interventions. You have several objectives there that relate to completing lead hazard control, responding to unsafe lead renovation, and conducting estimated a certain number of environmental investigations. Are those going to be independent of one another? They're mutually exclusive, or will it be possible to do an environmental investigation and then that same unit could count towards a lead hazard control? Like, can they be double counted for each of those things, or are these going to be categorically treated as individual things that don't get double counted?
You're correct, and that possibility could occur in terms of us responding to a case of a lead-poisoned child and then finding lead paint hazards and then notifying the owners that we do have those lead paint remediation funds available. So you're correct. We could end up counting it.
The same unit could count in multiple categories depending on what the total services are. Okay. Anyone else have comments or questions on this? Director Gallo.
Yes, thank you for the information. Can you share with us and the public in terms of, I appreciate the goals and objectives. We're right now throughout the city, county, state, we're dealing with budget issues. Can you share with us in terms of your staffing levels? Are we looking to enhance that? And so where do we get the money? Where's the money and so forth? More
Yes.
staffing and budget levels.
Thank you for asking that question, Dr. Gallo, since that is something that we talk about frequently in terms of being a small but mighty department and wanting to become mightier. That would require more resources, more funding. I literally just returned from Washington, D.C. In meetings with folks at HUD headquarters to encourage them to accept the EPA and CDC's recommendations that they provide more funding to Alameda County for child lead poisoning prevention. Because as great as this staff is that I have the honor of directing, they could do more if they had more resources and more staff to work with them. The other source of funding that we have been talking about quite a bit, in fact, with Supervisor Miley, is the proposal to put on the ballot in 2026 an increase to the CSA fee, and to also try to draw in the other cities in the unincorporated county into that fee so that we would have more resources, more staffing to do more work. And then lastly, of course, we have been fortunate to have the lead paint settlement funds, which will not last forever, but while we have them, we have been at least utilizing our portion of that funding to bring on project positions with the understanding that once the lead settlement funding runs out, those project positions would be eliminated. So it is my hope that we will be able to keep the folks that brought on into those project positions to keep them by getting more HUD funding, by getting CSA dollars, and also by maybe tapping into the city of Oakland's portion of the lead settlement funds, which, as you know, they have not spent any of that money that they have, except for to do a request for a consultant to come in and help them with coming up with a spending plan, which I hope that that consultant would include recommending some of the money be given to our department in order to enhance the services that we already provide to the city of Oakland.
So, but through your staff, you're monitoring what's given to other cities for implementation in terms of the funding annual, like for Oakland, it's an example. And what other cities do when you have a deficit, well, I'll take your funds and that bond and this bond to balance. Are you monitoring what Oakland's expenditures are and should be based on the level of need?
I wish I could. I was very concerned several years ago when the Millennium Paint Company settled out of court before the big settlement, and City of Oakland received about $500,000. Alameda County received $800,000, and I was able to account for the $800,000 that we spent when we started up the Healthy Child Initiative. But I was very concerned about City of Oakland was not utilizing that money, and after a few years, I discovered that they didn't even know they had the money until I brought it to the attention of the city council member. At that time, I think it was the city council president. That is one of the challenges with the city of Oakland. If you have turnover within the department, which I know that many of the departments in Oakland are losing a lot of staff. As a result, you lose that institutional memory in terms of elected officials coming in and out of the city council and the mayor's office. Again, you lose track of the money. I was able to help them identify that $500,000. I was told it was put back into the budget. I was told that it might have been used to help city attorney's office to go after rental property owners who weren't correcting lead hazards. I'm not sure of that. Yeah, I wish I had more ability to track those funds. I am very concerned about the $4.7 million that we agreed upon in the lead settlement to give to the city of Oakland to begin to come up with a spending plan for the other $9 million that is sitting in my budget. So I can account for that $9 million because they haven't come up with a spending plan yet. But I cannot account for what happened to that $4.7 million that we gave them back in 2022, other than to report I was recently told that they put out a request for proposal to hire a consultant.
Well, thank you. I'll check in with you. We do have a lot of staff changes going on and so forth. But I'll check in with you to make sure we follow up and serve the community with the funds we have. Thank you.
I appreciate that, yes, because I do understand that the city of Oakland has a huge budget challenge, and sometimes money can end up being diverted, although legally that money can only be used for child lead poisoning prevention.
Well, you know how government is. We find out after the fact, right? Someone's challenge is, oh, okay, we didn't know that. We weren't supposed to spend it in that direction. But anyways, I'll check in with you.
Thank you, sir.
Director Wengraf.
Thanks, Larry, for the report. Thank you, Ladise, for putting it together. Do we have any data about numbers of identified childhood lead poisoning cases? Are we seeing any trends? Is the number dropping? Is the number going up? And how is that data affecting the work of this agency?
Wow, I wish Katie was here, the head of our health department, to help answer that. But what I have been told is that the numbers did increase as a result of, during the pandemic crisis, children weren't being tested. And then as we came out of the whole COVID lockdown, parents began to take kids in to be tested again. And so I was told numbers did go up. Now, have they stabilized now in terms of testing? I'm not sure, but my response would be if the numbers have stabilized, it only reflects the fact that we still have so much more work to do with regards to educating parents to get their children lead tested. And that it really points to something that I really feel personally bad about, which is my efforts to try to get the state of California to copy other states in terms of just passing a universal blood lead testing law so that all children would just be tested. Then we would really know where we stand in terms of, percentages of children that are being lead poisoned.
It seems to me without having that data, it's very hard to evaluate the work of the agency.
I agree. I mean, that's one of the reasons why I'm pushing HUD so hard on providing us with more money based on CDC data and based on EPA data, because this problem really exists nationally in terms of having enough data to really properly resource everyone. The reality being that there's just not enough money currently in HUD's budget to really resource everyone evenly anyway, but at least looking at social demographic data, looking at, ages of housing, looking at populations within those communities with aging housing, can at least help in terms of giving us a clue as to where the lead poisoned children may be. As you know, I'm also a very big advocate for proactive rental inspection programs, which is one of the top priorities for City of Oakland, according to their race and equity impact analysis report, which is to be used in coming up with their spending plan. I believe that is one of the keys also to collecting data on, where are the health and housing hazards within our communities.
I don't believe in Berkeley, we have a pretty robust rental housing inspection program, but I don't believe they routinely test for lead.
No, and that is something that, again, I am pushing for all proactive rental inspection programs to train their code enforcement officers in testing for lead. Rochester, New York is my rock stars. They are the ones who began training code enforcement officers and building inspectors to become certified lead sampling techs. And over a 10-year period, they reduced their child lead poisoning rate by over 90% because they were able to truly be proactive in preventing children from being lead poisoned as opposed to being reactive and going into units after children have already been lead poisoned. So that is something that I am talking with Berkeley about, all cities throughout California, pushing for proactive inspection programs like that.
Other directors who have questions or comments? Director Arkin?
Yes, thank you, and thank you for the presentation here. And since I'm new, forgive me if some of these are dumb questions, but on the goals and objectives on page 8 and 9, it does mention on number 1, estimated 5,000 Alameda County residents will be reached directly, that 5,000 number there, and as Director Bowders mentioned on 1.1, 1 million reached through social media and et cetera. Is there an estimation on how many homes in Alameda County are actually, any estimation, affected by lead that need lead remediation?
Yes, and there are no dumb questions. That is a great question.
Thank you.
And there is data such as the U.S. Census data. There's data that many community development departments have in terms of the age of housing. We're fortunate in our work with own county public health department, the community assessment planning evaluation unit within the county public health department has put together some hotspot maps that identify based on things like age of housing, income, ethnicity, where we are most likely to have problems in terms of lead poisoning.
Okay. Any estimation on number, or do you know that at all right now?
What I can do is I can send you some of those
Curious.
hotspot maps.
Yeah. Okay. And it's homes built before 70, was it
1978 was
78, right? 78 or 73? I always think it's 73.
Now, in terms of the houses that are most likely to have lead hazards, you're looking at houses that are actually older than that. In that regard, City of Oakland has the highest percentage of aging housing in terms of, houses built before, say, the 1940s, where you're really likely to find some serious lead hazards.
Okay, and is there any targeted outreach or the numbers that are in the goals and objective that I just identified, is there a more, I don't know if that's just more of a general outreach, is there more targeted outreach towards those homes, neighborhoods that are mostly affected?
Good question again. With regards to how we're using the lead paint settlement funds that was awarded to us for what we call Lead Safe Alameda, which is outside of Oakland, we are doing some targeted work. We are proposing to the City of Oakland that if you will allow us to use a portion of the settlement funds that is designated for Oakland, that we would apply that same strategy in terms of targeted proactive efforts.
Great, great. One more question. I notice on community outreach, all of the bullet points here, a lot of childcare providers are listed. I didn't see, and maybe I'm missing it, the public schools. Is there any outreach that try to outreach to parents through the school? Sometimes that's a great outreach mechanism.
Yes, and again, it's a great question, and again, I have to apologize in terms of my own failures to work with the school districts. We have been trying, but we have not been very successful. We have partnerships with the school nurses. I have spoken before, for example, the Oakland Unified School District on occasions. Usually it comes up when there is an issue of water. The water faucets within the schools, sometimes they will test them or they will see actual dirt and rust in the water, and I'll be called to the school board to come talk about lead poisoning prevention. And I always mention to them that there are some states like Iowa that actually require children to be lead tested before they enter kindergarten so that they can figure out right away, is this child going to need to go into special ed classes, or if the child is in special ed, that they have some idea as to maybe why that child ended up in special ed. Again, I have not been very successful in convincing them. I think it's for the same reasons as perhaps with the water, or at least that's what I've been told by some insiders, is there's always the fear of litigation. And by the way, happy Law Month. May is Law Month, I've been told. But yes, the school districts tend to not want to get involved because they believe that perhaps if a child is tested before entering school and they have lead poisoning issues, that somehow it's going to bounce back on them, which I don't think it would. It's more likely that after the kid gets into school, maybe first grade or something like that, if they tested positive for lead, perhaps someone might turn around and try to say, your drinking faucets poisoned my child, and there might be a lawsuit. So I really think it would be to their advantage to get the kids tested before they enter school. It's worked very well within the state of Iowa, and it's something I will continue to push for.
Yeah, that would be great, because that's a great way to test and to reach families and that sort of thing. It's unfortunate that you encounter that kind of pushback and challenges, but thank you for that. That's all I have.
Director Vella?
So building off of that, Director Brooks, I do have a couple suggestions because California is in the midst of the rollout of universal transitional kindergarten, which I think is something that is substantially changing the overall structure of public education in the state. And we've seen our enrollment for TK statewide actually exceed what the expectations were originally for that rollout. But all of our districts in Alameda County are participating in UTK and UTK expansion. Some of them are doing beyond the minimums required with that state rollout. But I think it might be helpful if we developed even a flyer, because sometimes these things aren't even about a meeting. Sometimes it's just about creating what we think would be helpful and then giving it to them to say, hey, you may want to send this out as part of your back to school efforts or your enrollment efforts. So a couple of thoughts. One, they could, if we give them the resources, or even if it's just, hey, you can link as part of the enrollment process, where we give a little, like our pamphlet on, why blood lead testing is helpful and important. That's just something that they could pass on to parents. Two is that we could link even to our website and our resources, which they might be willing to do if we give it to them in a really succinct way. And the other thought is it might be worth, and I know you do a lot of advocacy in Sacramento, but meeting with DSS as part of, they're the ones that are leading the UTK expansion efforts and rollout in collaboration with the California Department of Education. But it might be helpful to meet with them to just say, hey, I don't know if we've thought about this, but we may want to create some resources to go out and maybe engage. They'll certainly bring in CDPH, I'm sure, but it just kind of at least flag it for them that maybe CDPH develop or riff off of something that we've already have. So CDPH could weigh in, they could provide it to DSS and CDSS and CDE to do that. So just something, I think it's a good time of year to be thinking about this, because also there's going to be all the back to school efforts. Parents are already having to put together vaccination reports and all of those other things. So, it's just a good time for folks to be thinking about it. We don't necessarily have to advocate for anything. It could just be, this is what the blood lead test does. This is what it's for. If you reside in these, it doesn't really matter where you reside. We've been over this. I mean, I had this conversation with our primary care provider. It doesn't matter the age of the house, because your child could be getting cared for somewhere else or having other options or opportunities for exposure. And so I think we could do that with hopefully not too much staff effort, because I think a lot of those resources already exist and maybe we can just share them over. And I'm certainly willing, if I get copies of them, to pass them on to our superintendent in Alameda and county superintendent and others as well. So with regards to compliance, the second point is the CLPPP. I just wanted to understand who's participating in the process for developing the standard operating procedures.
Okay, and that is on where?
Page 14.
Updated enforcement response policies and procedures. Yes, that is something that I am personally taking lead on.
Great. And you're developing them? Are you doing outreach relative to that, or bring people in? What's the process?
Yes, part of that is bringing people into the fold as far as enforcement. And that is something, in fact, I was going to mention in my director's report in terms of the city of Berkeley, which I'll get to that.
Okay.
But yes, that is something that is part of the plan.
Okay. And then I know that there's a bullet point under activities, and one of them is collaborate with the Alameda County DA to establish a formal referral policy and procedure. I just wanted to flag City of Alameda. We have our own internal prosecutors unit in our city attorney's office. And so for a lot of property-based issues and disputes, our city prosecutor handles that. So I just want to flag that in addition to working with the DA, you should also reach out to even Shen, our city attorney.
Thank you, will do.
Any other comments or questions on this item? Okay. Director Hardy, do you have a comment? Can we turn her mic on? That's okay. Just pull it down once it's on. Hit it once in the green button.
Oh, I understand that. I'm sorry that I was a little late. My question was having to do like with the lead testing, of children. Do we at this time have anything that is like state recommended? Or is it that we're only working like with counties? Because I know that when our organization, Pueblo, People United for a Better Oakland, worked on and was able to get this lead poisoning program, Healthy Homes, that a lot of the other cities, were not interested, in participating, even though they were a part of Alameda County. So I'm just wondering, like, have we been able to get those cities, like, to come and be a part of this? And how overall is this lead poisoning testing been going as far as like our children? I'm asking this because I am, well, my husband is deceased, but I am still a mother, a grandmother, and a great-great-grandmother. My youngest great first only grandson is 5 years old. So I'm still very interested in, like, what's going on as far as like, the pain and what the state as a whole like is doing, around this issue. Or is it only that we who are a part of Alameda County only really consistently working on trying to improve and make this situation better?
First, congratulations on being a great. That's a blessing. And then I had to hold my tongue there for a minute in terms of you asked for the state, California Department of Public Health position on child lead poisoning prevention. Director Bella kind of touched upon it in terms of when we were seeking, and we will, once again, I'm sure, seek universal blood lead testing. The state's position was it's okay to just have the doctor ask the parents questions like, do you live in a pre-1978 house? And then that would trigger whether or not they did the testing. And we know that there are lots of non-housing sources of lead poisoning, and so you shouldn't do it based on a questionnaire. That's why we should have universal blood lead testing, and the state wasn't ready to do that. Like, I believe 14, 15 other states in the nation have already moved in that direction. Just get all the children tested. So that's a battle that we still have to fight, and it's a very political one. Director Guile touched upon it in terms of, everybody looks at budgets and how much is it going to cost. And I know that was a consideration too in terms of those who objected. The last 3 times we've tried to introduce the idea of universal blood lead testing, even the pediatricians opposed us and said it was just adding to the work and to the costs, and so they didn't feel they should do it. As quiet as it's kept, there were even some nursing organizations that were opposed to universal blood lead testing because, again, it was going to create more work, more costs. And within the child lead poisoning prevention programs up and down the state, there was reluctance and resistance amongst the public health nurses because they felt that it was going to increase the caseload, but the state would not pay for more nursing staff to respond. So it's an uphill battle, but it's one that I haven't given up on yet, Director.
Yeah, unfortunately, that's the problem. I know when my organization was working on this campaign, it was an issue in being able to get California to endorse, the lead testing. And I remember, which my oldest daughter is 61, and they did some testing when she was a child in school, but they only said negative, so I never really knew exactly what that meant as far as like numbers, whether her lead level was high, whether it was low, like whatever. For me and for her, it doesn't seem to have affected her. She's doing good and all of that. But I know that we as an organization worked on this issue for a very long time and a lot of resistance. And especially like in some of the cities that are not a part of this, but are a part of Alameda County, So, I am glad for all the work and the, trying to think of the word, the things that we have been able to create around this program since Pueblo initiated it and the county did, the Alameda County lead poisoning. Because it's very important, people don't realize, and even though it was something that was realized even many, many, many years ago, that lead in the paint was poisonous to the people that were working with it and so on. And if you remember, I think it was one of the Bush wives whose dog was affected by lead poisoning also.
W.
So maybe we need to um, try to find a way where it's that we can bring this more to the public's attention than they realize, and how important it is for our children to be tested. You know, we talk about it, especially our children of color, misbehaving and doing things at school that they shouldn't be doing. But sometimes it has to do a lot of times with environment. And it could be the toddler was chewing on the windowsill, and if all of you all remember, the lead paint has a sweet taste to it. And so this is why children were affected to it, and any peeling paints, they would pick them up, put it in their mouths, and all of this. So these are things that we learned working on this issue, and that was very important to us that we establish something to at least help the situation and to alleviate maybe some of the issues that were happening with our children in the public schools.
Totally agree with you, Director Hardy, and I thank you and Pueblo for the work they did. I often remind people that we would not exist if not for those efforts. And in regards to the schools, that's, again, something I keep emphasizing when I talk with Oakland Unified School District, which, as you know, Director Gallo, has budget woes always. And they always point to the fact that they have more kids in special ed than any of the other school districts. And I always say, okay, connect the dots here, folks. This is one of the reasons why we should make lead poisoning prevention a priority as opposed to being reactive and waiting until kids get poisoned.
There are a lot of old houses that, in the paint, and people paint over the peeling paint, and then they're not careful in shielding the environment, which means the adults as well as children, when they're renovating, properties and things. So it's an ongoing issue, and it's something that I'm always very much concerned about. I'm not getting any younger. I'm in my 82nd year of life, thank goodness. Don't know how much longer I'll be able to be attending these meetings, starting to have a little problem with body parts. But I am also very happy for so many things that have been implemented since Pueblo was able to get the counties that decided to be a part of this, so that we would at least have something in some element and some way of trying to fight this issue and to bring it to the attention of the public, that this is a very important issue. It's just as important as childcare. And those places are also important, as to whether people have the knowledge of that peeling paint and things of this issue are very important where our young children are going. There are a lot of unanswered questions as to why our children, especially people of color children, behave certain ways that they do. And sometimes it has to do directly with where they live, how they live. I'll get off my soapbox. Thank you.
Thank you, Director. You mentioned unsafe renovations. I will talk a little bit about that later on in the Director's report.
Thank you. We'll move to item 5, which is the budget for fiscal year 24-25.
I'm sorry, can I interrupt? There's a public comment from someone that's attending remotely in the goals and objectives, and also the goals and objectives is an action item.
I had called for comment. I will reopen public comment on item 4. Commenter has 2 minutes.
Please state your name and which item you're speaking on. You're on the line.
Yeah, hi, this is Sony Johnson. I'm with Alameda County Healthy Homes Department. I'm part of the outreach team. Just wanted to give some clarity and updates on some of the questions that were being asked. And in regards to the budget, the goals and objectives. So there was a question about how many lead poisoned kids do we have? Is the number increasing, decreasing? What are the rates? I can let you know that the numbers have slightly increased. In regards to the rates, we have 3 levels that we respond to when it comes to lead exposed children. Currently, we have 800 basic rates, which are levels of 3.5, and then to, I believe it's 9.4. And then we have 120 potential cases, which is 9.4 to 14.5. And then 110 state cases, which are the medical case levels, which are over levels of 15. So we do have quite a bit of lead exposed children that are currently being identified in the county. The reason for the increase is because we are servicing lower level children so that we can prevent these children from turning into state medical case levels. The other thing that I wanted to comment on is why aren't we in the public schools? So currently we are doing a initiative to all of the child cares, which include the Head Starts, the child development centers, because when it comes to lead poisoned kids, we want to get them tested at 12 and 24 months of age. And usually we want to have them identified with proactive responses or preventative responses prior to school age, because once they're identified at school age, then really a lot of the only recourse that we have is special education. So our focus and our goal is really to get these kids before they enter school. And so we're doing a very targeted, very comprehensive outreach to all of the child cares, center-based as well as home-based. This is throughout Alameda County. We're rolling it out in different sections, and we've already started our outreach in regards to incorporating lead education for the providers, as well as the parents through the licensing process, through parent orientations, through parent meetings, and staff trainings. So we are working extensively to try and reach out to children before they become school age. However, we do have relationships with a lot of the school districts where when we do have a targeted campaign, such as the one recently in San Lorenzo, the unincorporated county of Cherryland, we were able to send out mailers and flyers to all of the elementary school children to promote a soil testing event that we did in that community in the month of April. So we do utilize those resources. If the campaign for child care outreach is successful, we will definitely roll that out to the TK program, because again, those are targeting children under the age of 6, which is our priority. So I definitely appreciate the recommendation from Director Vela, and we'll reach out to that. And then in regards to the age of or the amount of houses that are most susceptible to having housing-based lead sources, I do have the numbers, and I can either quote them right now, or I can send an update to the JPA board, whichever you would like.
We'll have that sent in a summary with other information that will be collected from this meeting as follow-up and sent to everybody in writing, please. I'm going to recognize Director Vela.
Thanks, Sony. It's always great to hear from you, and you always have all the information, so I appreciate it. I think the other value, and you kind of alluded to this, is also, parents of a TKer probably have other, they may have other kids at home, younger kids. And so I think whenever we give them that information, it not just helps, not only helps that one child, but it helps potentially other children that may be in the household. And my sense of it is that our districts, it's not really a reticence to send it out. It might just be that they don't have the resources. They don't see themselves as the experts. So to the extent that we have it in multiple languages, things like that, it's also something that as they're doing their back to school or open house work, we may want to, I think also giving suggestions of where it can fold into the activities that they're doing as opposed to being yet another thing that they have to do will be helpful for them. So the easier we make it for the schools and the LEAs, the easier, the more likely it is that they'll actually share the information. So I appreciate it. Thank you.
Thank you, everybody. We're going to move to item 5 now, the budget for fiscal year 24-25. Good morning.
Good morning, Board Directors.
Oh, we need to take a vote because it's to approve it. I apologize. So we're on the goals objectives for fiscal year 24-25. Is there a motion?
Move approval.
Thank you.
Second.
Thank you. So there's a motion by Vella and a second by Wengraf to approve the proposed 24-25 goals and objectives. Please call the roll.
Director Hardy? Alternate Arkin?
Aye.
Arkin, aye. Director Vella?
Aye.
Vella, aye. Director Wenraff?
Aye.
Wenraff, aye. Director Gallo?
Aye.
Gallo, aye. Director Wouters?
Aye.
Wouters, aye.
The ayes have it. The motion carries. The goals and objectives are approved. Now we will, for the third time, correctly move to the budget. Thank you.
Good morning. I will be reviewing the budget for 24-25. And the details on pages 15 through 17 in the packet, which was presented for you to review. I'll be highlighting the things on page 18. There are certain items I would like to highlight, such as HUD LHC, lead hazard control. There's a 39% increase from 2 overlapping HUD grants, with HUD 27 ending and HUD 31 starting. For EPA, there's a 100% decrease. We completed our deliverables and the grant ended fiscal year 2024. CDBG minor home repair, there's a 34% increase. We do not anticipate completing our project by June 30th, and the funds will go into the next fiscal year. Unincorporated rental minor home repair program, there's a 36% decrease. This program ceased taking applications in February. The funds for fiscal year 25 are projects in progress, which should be completed by December 2024. For lead settlement funding, there's a 31% increase. We forecast additional lead settlement funds are needed as we ramp up lead settlement activities in the county, including additional project staff and community contracts. Any questions on the revenue section?
Are there any questions on the top half of page 18, which is the summary of revenues? Director Arkin.
Yeah, just a quick question. So on the lead settlement funds, that's with the exception of the ones for Oakland, right? Is that correct?
Correct.
And they have those within their city? That's right?
Yes.
Okay, that's all. I just wanted to clarify that. That's it. Thank you.
You're welcome.
Anyone else? Okay, we'll move to expenses.
Yes, thank you. For discretionary expenses, there's a 17% decrease. We will not pursue some contract at this time, such as the HEPA vacuum program. However, we will be using this funding for staff to provide more direct services that was mentioned in the goals and objectives. For non-discretionary is services provided through the county, such as county council, ITD. There was a countywide cost of living adjustment and raises. Lead hazard control grant, minor home repair and relocation, there's a 42% increase, and that's from the HUD 31 grant funding for projects. Salary and benefits, there's a 13% increase. As mentioned previously, there was a countywide cost of living increase. Personnel costs will increase by an average of 9% over the next 3 years. About 60% of Healthy Home staff is represented by SEIU 1021. And I have one final comment, which is for Director Hardy. For the outreach and education, we're going to continue to do in-person events, online presentation, collaborations with partners, and contract with CBO to assist with more of our outreach efforts. And that's the end of my expenses.
Are there any questions on the expenses side of the budget? Is there any public comment on agenda item number 5?
No public comment?
Comment is closed. Is there any discussion or debate? Hearing none, is there a motion?
Move approval.
I'll second.
Thank you. Motion by Vella, second by Arkin to approve the budget as proposed. Please call the roll.
Director Hardy? Hardy, aye. Alternate Arkin?
Aye.
Arkin, aye. Director Vella?
Aye.
Vella, aye. Director Wenroff?
Aye.
Wenroff, aye. Director Gallo?
Aye.
Gallo, aye. Director Bouters?
Aye.
Bouters, aye.
The ayes have it. The motion carries and the budget is approved. We'll go to item 6, the director's report.
Okay, and first, thank you, Joy. You've now completed your first budget presentation, and I really like that you threw in that little side note there. Director Hardy typically does ask questions about community outreach, and Joy had it covered for you, so thank you, Joy. As I mentioned before, I literally just got back from Washington, D.C., so there wasn't time for me to do my usual PowerPoint slide presentation, but fortunately with all the other items we had to cover, I just have a few notes that I wanted to go over with you. I was brought to DC to provide input into the future of the HUD Office of Lead Hazard Control and Healthy Housing. They're looking at issues like the ones that we're dealing with now in terms of sustainability and succession planning. This was my second trip there. I was there last May. We have quarterly meetings with that panel, folks from HUD that we do virtually. But I was just told as I was preparing to leave that they're planning to bring me back out to DC for a couple of more meetings in the next year, or at least 2 more. Supervisor Miley has indicated that I met with him just before I left for DC. He indicated that he is going to probably appoint a new alternate because Director Arkin, my understanding is, yeah, you do lead a busy life as a city council member in Pleasanton, and it is quite a commute for you to be here. And I really appreciate all the trouble you go through to be present. Supervisor Miley does intend to relieve you of that suffering. Not sure when. He just said that he will probably do it before the end of the year. But here's the other thing. I guess misery loves company. He indicated that he has hopes of actually attending the JPA meetings himself beginning in 2025. The challenge for him right now is this Thursday morning meeting time doesn't work for him. So if there is a change in time and location, he believes that he will be able to start attending personally beginning in 2025. The other thing, Oakland reached out to me just as I got back from DC with an apology for not responding to the announcement that I made last month here at JPA that we would no longer utilize HUD funds to offset their higher cost lead paint remediation projects because it takes away from funding that could be used in other JPA cities. Caleb Smith, the city of Oakland, indicated to me that, as I mentioned before, they're seeking a consultant. They hope to be able to begin discussing with us the use of the lead paint settlement funds, the $9 million sitting in my budget that under the lead settlement, it has to be spent in Oakland, but as to how it is spent under the judge's orders, we have to negotiate that. So he is indicating that they think they'll have their consultant on board by June or July or August. He said definitely by August, and that they would then be ready to sit down with us. I have a problem with that. The problem is I went and looked at the request for proposal that they had put out. And in that, it says that the consultant will have up to at least 1 year to come up with recommendations and may be entitled to extend that for another year. So my thought is, how can you talk to me until, since you've been saying since 2021, you needed a consultant before you could talk to me. So how are you going to talk to me in August when you just bring on the consultant? I think you're not going to be able to talk to me for at least a year after you get that consultant per the contract. However, to help move that along, I did inform Caleb that I have recruited several potential applicants for the position as consultant by making announcements, not only at HUD, but at the California Healthy Housing Coalition, to their steering committee, to the board of directors for the National Lead Environmental Hazards Association. And since I chair the statewide lead paint settlement work group that meets every other month, I also made an announcement at their last meeting, and I got responses from all those different groups that they had names of people that they would recommend apply for that RFP. Now, I don't know if that helps or not. I hope it does, because I anticipate Oakland may have trouble finding a qualified consultant to do that work. And then lastly, we've been touching upon the Environmental Protection Agency's renovation, repair, painting rule, also referred to as lead safe work practices, training and certification. We have been providing free RRP training to code enforcement officers and building inspectors within the CSA cities. I think going all the way back to when I first arrived here in 2013, with the hopes that as people complained about painters and contractors going out there and scraping and using leaf blowers and stuff to get rid of paint chips and using sanding equipment without any plastic containment, using workers that didn't have proper PPE. The hope was that we would be able to curb that if we taught code enforcement officers and building inspectors, actually got them certified in RRP, because all painters and contractors should be EPA certified when they're doing that work. And we know that there's a lot of them out there that are doing work, creating lead hazards, as you mentioned, Director Hardy, which results in children, not only children, but even some of the workers have gotten lead poison. And that's why we've had some success over these last 11 years with getting some code enforcement officers to begin responding to complaints about unsafe work practices. So I was a little bit surprised and disappointed to hear that Berkeley is no longer responding to unsafe lead work practices complaints. And Director Wingraf, I've taken the liberty of notifying the city manager, D. Ridley Williams, of what we just learned, because I'm sure that there's probably a good reason for that. But the reason that we were just told this week by Mark Sporot, I might be mispronouncing his name. He's the Senior Registered Environmental Health Specialist in the Environmental Health Division, Health and Housing and Community Services. He said that they don't enforce because they no longer have the California Department of Public Health Child Lead Poisoning Prevention grant, which is strange because Berkeley has never applied for that grant. I've always been told that Berkeley felt that it's all the child lead poisoning prevention programs are entitled to a portion of the grant based on a formula. And I've always been told that Berkeley's allotment was too small for Berkeley to apply. So when he said, we're not responding to unsafe lead work practice complaints because we no longer get the DPH grant, and therefore we're referring it to the regional code enforcement folks within the EPA, I was kind of surprised. Again, because for a while they were doing that as a result of the training. So what I'm proposing to the city manager is that we investigate that. Maybe again, Director Guile, there's always turnover. And maybe we've had some turnover within code enforcement and we need to train people again so that they feel comfortable responding to those types of complaints. So that's what I'm proposing to the city manager.
Is it possible for you to CC me on that communication?
I sure can.
Because this is news to me. I don't know anything about this.
The other thing that I am proposing, that because I know that Berkeley has never applied for the California Department of Public Health grant, that perhaps the city council could ask the California Department of Public Health to include the Berkeley allotment in the county's allotment of funding. Because if it's too small for Berkeley, but we have historically assisted.
That won't work because we have our own health department.
Correct. That's why you're entitled to the funds.
This is a conversation that you should take offline with the city of Berkeley.
Yeah,
Okay.
but I would appreciate seeing the past correspondence
Yeah.
and,
I don't think it's helpful to share this right now because Director Wengraf has expressed that she doesn't have any background on this. So providing this information here isn't going to lead to a discussion, unfortunately. So I think the best thing to do is give her that information offline and give her the opportunity to be caught up on that issue. And then we can come back and talk about that further if there's recommendations needed by the board. But without her having seen this or being copied on this to date, hearing this in an open meeting isn't going to help her address this issue publicly.
Then yes, we can talk more offline. Thank you. That was the last point that I needed to make for the director's report.
Okay, is there any public comment for the director's report?
No public comment?
Is there anybody who wishes to discuss the director's report or ask further questions? Director Arkin.
Yes, thank you. Thank you for all that information. Just a couple of things. One, regarding lead in children's blood, some children have been testing having lead in their blood preschool age, I think, and younger elementary school age that are in the flight path of the Livermore Airport. There's a big push with parents right now in Livermore and Pleasanton that have a lot of concerns. And I don't know if there's been anything with like Hayward or Oakland airports with the same experience. And there's a push right now too to switch to unleaded fuel. The fixed-based operators have been kind of fighting it because it's an expense for pilots to switch to be able to use unleaded fuel. But anything, are you aware of any of this issue with the fuel, the unleaded fuel with the airports?
Yes, I have been brought into that. And in fact, I was brought into those discussions with the airport in Santa Clara because that was the one that first kind of put the spotlight on this issue. And then I was contacted by residents there in the Livermore area expressing their concerns. So yes, I am talking to some folks with the state agencies and federal agencies about what is to be done and how are we going to move these operators to using unleaded fuel when they're saying that some of these planes can't operate on unleaded. So that's part of the resistance.
Yeah, so I have a little information on that. So as a former city representative to the Air District, this was originated when Supervisor Chavez in Santa Clara County got report information about the impacts of lead-based fuel exhaust over residential areas approaching the airport in San Jose. And there was a concerted effort in partnership with, people in Congress and others to address this. And my understanding is that the Air District only gave one airport in the East Bay such a notice, and it was Livermore's airport. And I met with Mayor Marchand about that a week ago, actually. And I do understand that there is a transition to a combination of biodiesel and avgas and other things that can be used to operate some of these smaller planes, but not all planes' combustible engines are conducive to the combination of fuels. So it is something that's going on, but it has been initiated. It doesn't really fall within our jurisdiction, actually, because it's an air regulation it's kind of a weird space. But my understanding is that the Air District and CARB are working on that issue, and I'm not really sure why Livermore was isolated in terms of getting that notice, and other private and smaller airports did not get that notice, a letter to correct. I am trying to understand that a little bit better. I guess it's the proximity due to a denser population.
Okay, okay. Well, thank you. Yeah, it's becoming a big issue out there, so I just wanted to bring that up, but thank you. One other question, and this might really be a dumb question, I don't know. So with remediation with lead paint, does it have to be scraped off or sanded off, or can you paint over it to remediate it?
Yeah, that is a good question again, because we're always having those discussions about interim controls versus permanent abatement. Where in permanent abatement, you do scrape it all the way down to the wood and then you paint over it. That's very expensive, but if you can remove the loose paint and then paint over it, which is called interim measures, that's less expensive. Now, of course, that means it's not permanent. And so you have to be vigilant in terms of continuing to inspect and identify when the lead hazard comes back, so that you can then do more remediation. That is something that, again, I believe, I'll say we believe, the Healthy Homes Department, that by having proactive rental inspection programs, you will have that constant assessment of the condition of the paint, so that you can take action before children are poisoned.
Thank you. That's
Any
all
other
I have.
Okay, any other questions? Okay, there's no action requested on this item, so we'll move to item 7, which is the monthly report. It's on page 19. Ladisa, do you have anything you'd like to add beyond what's in the packet?
No comment.
No? Okay. Is there any public comment on item 7? Seeing none, is there any director discussion on item 7? Monthly report? The next report will be the last report for the fiscal year, so we'll see if we've met our metrics at that time, correct?
The next report is May, so you have 2 more months.
Oh, you're right, so it's the report after, so it'll be 2 times that. Okay,
In July, in the month of July, you'll be able to see
the year end.
final numbers.
Okay, thank you. All right, so hearing no discussion on that, we'll move to item 8, future agenda matters. Is there anybody who wishes to request an item for a future agenda meeting? Seeing and hearing none, item 9 is announcements by members of the board. Are there any members who wish to make announcements? I'll just wish everybody a happy start to summer next week, even though I know summer is formally in June. Memorial Day is kind of actually most of our summers. I don't know, I grew up in the Midwest and we went to school into June, and like here people don't do that. And I'm like, what? I was like robbed of my childhood because I like dealt with snow all year. So I don't know. So happy to all the parents and grandparents and people who will get summer early, because back in the Midwest, they still go to school. All right, well, that brings us to the conclusion if there's no other announcements. 10:38, we are adjourned. Thank you.